continuing challenge for people that need to be here to work to juggle the arrangements around childcare. And we have great respect for the difficulties and the barriers that they've worked to overcome to continue to be there for the citizens of our community. We also know that students have lost their routine connections that they had to the regular life of school and the relationships, the face-to-face relationships with their friends. A lot of those are certainly all being done remotely. And teachers are facing a lot of challenges for delivering lessons online to homeschooled audience. I have two college boys, twins, who are taking classes remotely, and I'm watching that in real time. Some of them who have technical classes that used to have labs that are difficult to deliver in this environment. We also know that support staff like bus drivers, those working in food service, those that maintain buildings and grounds, student aides and others, countless others, are in a difficult spot given the disruption that this is caused. We know that it's been felt in every school and in every community. And despite these many challenges, we also know that this is the right thing to do. This is the right thing to do to protect our families. And we want to thank everyone who has made these sacrifices, who has played a role in helping students and families adapt to the change this year, and also recognize the pain that the disruption has caused in the situation that we find ourselves in, and know that ultimately their sacrifices are saving lives. And I think we keep front and center in these difficult moments, is every step that you've taken, every sacrifice that you've made is related back to a life saved, a case prevented. And there's great appreciation for that, and there's a lot of solidarity as a community in that regard. So we know that the governor has recognized that there will be a gradual return to normalcy starting on May 1st, and not a full-scale launch back to life as we know it. Just as we think about the fact that we have schools now that we've extended to the end of the school year, how we think about how businesses reopen, how people interact in other environments, all those things will be gradually reinstated. And so we think that you need to understand that we're going to work closely with a variety of local folks, state folks, to talk about the proper protections for customers, employees, and citizens as we do so. What we expect, and many models talk about, is that we may face in the coming months a range of clusters that may still emerge. We have to be prepared to identify, respond to, and suppress clusters of illness going forward. That may very well be the order of the day. The key is that those clusters are suppressed so that they don't begin to move out into the general community, where we then could see a reignition of cases. We have successfully, and this is, I think, important knowledge, we have successfully really plateaued at this point on our cases, and we want to stay that way. The curve has been flattened, and Ohio has been successful in doing that, in preventing much greater levels of cases and fatalities. But we still have a lot of work to do so that we don't reignite cases in our community. So we need to remain vigilant, and we intend to do so, and we appreciate the governor's leadership in doing that, even as we have this gradual reopening. So it's a delicate balance. It's really an equilibrium between what we do to open up, to begin to address important economic issues and protect the public's health. So it's quite a fine line to walk. So we want to thank everyone who has called about their concerns related to these issues. We expect that in the coming days here, you're going to see a lot of guidance emerge. Guidance around masks. We know that you've been seeing everyone here wearing masks and making sure that you've got a mask in public. We have, of course, distributed masks to our workers who are out in the field working so that they can use these cloth masks. We're still saving surgical masks and saving the N95 respirators and the like for our safety forces and for our healthcare workers as appropriate. But we know that CDC is releasing information that describes that masks are protective. Cloth masks, they provide a degree of protection. We know that done with social distancing, physical distancing, They can't help to prevent the spread. They're not the same as the hospital equipment that people use, but it is, in our current situation, it is a good choice for the public, and we highly recommend that people do this when they're going out into the community. My parents, who are approaching 80, and I apologize for saying that on camera, Mom and Dad, but they have been wearing masks in public. My mom has been staying put most of the time, and I'm glad about that. If my dad ventures out, he's wearing masks. He's often wearing gloves when he ventures out. But they're taking precautions, and I think that's good. So we should all follow that lead and do what we can to prevent exposing us to other people, because we know now that the number of people that may actually be asymptomatic carriers, may actually have COVID and not know it, could be between 40 and 50% of us on new data. So lots of people out there that may very well be asymptomatic carriers, and that is another justification for being careful going forward. We get a lot of questions about what will happen with warm weather, issues around what will happen this summer, and is it still a risk? And the answer is we do not know. This virus has never been in the summertime here in our community, has never been in a person during that period of time. We're not sure whether it will continue to persist through the summer or subside and reemerge in the fall like flu does. That's too early to tell. We really are learning in real time with this new virus. So masks, physical distancing, frequent cleaning of commonly touched surfaces, hand washing, and guidance around a variety of settings, whether it be recreation or summer-related activities, will emerge, and the guidance will be important for people to follow. We've been having lots of conversations with our municipal governments about how to do that, and guidance will be forthcoming, working with the state health department. And so by taking these precautions, we can help to maintain this curve, this plateau, in a flat manner. And we intend to continue to do this. It's really a fine balance. So we wanted to speak briefly about our staff here at CCBH and how we've done business. I've mentioned that over the years I've been involved in a lot of emergency response. And what we learned from the folks that were part of the wildfire response in Southern California is the incident command system that we operate in. I come from a family of firemen, and incident command is second nature to folks working in the fire force, how they extend mutual aid across a whole range of fire companies in different municipalities to support each other. And so this incident command structure means that there are specific roles that people follow, roles around logistics and planning, and roles around communications, roles related to incident command, and Dr. Gullett and Ramona Brazil from our office have been working in the incident command role, and we're very grateful for their leadership in this particular response. So all of us play a role in this incident command structure, and public health has learned from safety forces about how to implement incident command. It assures that everybody knows what their role is, what their responsibilities are in their role, what the cascade of personnel is that need to be in those roles, as you assure that you're allowing people time to take a break and others to step forward and fill those roles, as you work with your department operations center locally here or with our emergency operations center that the county has organized for us. All those pieces work in unison, in concert, to assure that the response is done in an organized way. And so we continue to work in an incident command role here in this response. And it's a tried and true method to assure across the country that you have a unified response, and certainly here in the state of Ohio. Natural disasters, man-made incidents, and infectious disease outbreaks and pandemics like this are all incidents where the incident command structure is implemented. And so wanted to give you a sense of that. The best way to learn about incident command, I think, is to call your local fire chief. They'll tell you about incident command. It's how they were born and raised, and we are taking a page out of that book. So with that, I wanted to thank anyone in advance as we move toward May 1st, and understand that don't expect that we're going to flip a switch and we're going to begin returning to life in the way it used to be. We can't do that yet. We have to continue to ask more from all of us to be protective, to assure that we are not reigniting this pandemic here in terms of new cases and potential fatalities. We need to continue to be vigilant. We can't take our foot off the gas. With that, I wanted to ask Dr. Gullett to come forward, and we're sharing our Cleveland sports masks, and she's here to talk about the fall sports, I think, now. So thanks.
We're not leaving the Cavs out. We just need to find a Cavs mask. Rest assured, we love the Cavs as much as we love the Browns and the Indians as well. Good morning. Thank you all so much for being here. Thank you all so much for wearing your masks and social distancing here when you're in our building as well. Thank you for continuing to report on the issues that COVID-19 is causing in our community, and also on the ways that people are helping one another. That's equally important. This is a difficult time for everyone, and we appreciate all of the media coverage, helping everyone to understand what's happening in real time. I'd like to thank today all of those of you who are at home working remotely while you're managing your children's education and your jobs. That is not easy. We recognize the immense impact that has had on you. I continue to look at reports of people trying to balance Zoom calls with children on their lap and trying to make sure that they're productive for their jobs while their kids are productively learning. And that's a difficult feat, something that most of us have never experienced before and hopefully will not continue once we're past this. But we thank you for fulfilling those obligations in a way that protects our community from further spread. Being at work physically with others, even while wearing masks, still represents a potential route of transmitting the virus between people. And so that's why it's really important to continue doing this, and we thank you for that and want to recognize the sacrifices that you're making for that. I also wanted to thank Kendra Bates here at the Cuyahoga County Board of Health. She ordered me this fancy, beautiful new white coat. My old one was from 16 years ago and didn't have the Board of Health logo on it. So Kendra, if you're watching, thank you so much. It is much appreciated, and hopefully I'll wear it proudly through this. I don't normally wear a white coat, but this pandemic has resulted in me wearing a white coat more in the last month than I have in the last 16 years. So I will continue, but thank you for that, Kendra. And finally, I wanted to also thank the staff of congregate living facilities in our community. Those include residential homes for adults and children who are developmentally disabled or have other issues where they need long-term care. I also want to thank those working in our shelter systems. You provide a service for our community that most of us could never comprehend, how much work you do day in and day out to serve our community with food and shelter. And we thank you for that. We also know this is a tremendous sacrifice that you're making, and your families are at risk as you come to work every day and are potentially exposed to the virus as well. But we thank you for the life-saving work that you all do. And I wanted to specifically call you out today for the service that you continue to provide for our community. Before I give you our data, I want to again remind you that everyone represented in these data are invaluable members of our community. They're all people that are loved ones of others. And so please continue to remember these families affected by the virus in the most profound ways. We thank, again, our county executive for putting the flags at half-staff, and we here at the Board of Health continue to honor and think of the memory of the people that we've lost to this. So our total lab-confirmed cases for the CCBH, so Cuyahoga County Board of Health jurisdiction, are 1,028. The age range for those cases remains at 1 week of age to 101 years of age. And the date of illness onset is February 29th to April 18th. And again, there's continued transmission. That's what those date of illness onset represent, and that's why I continue to tell you about them. We continue to do dozens of interviews every day of new cases, and so we know that those people were likely exposed between 2 and 14 days prior to the time they become ill. And so we know we're continuing to have more infection in our community. The deaths in our community are 56, and again, this does not include fatalities in the city of Cleveland, who are independently reporting. The ages of the deaths in our jurisdiction are 53 to 97 years of age. And the dates of death are March 20th to April 19th. We've had a lot of discussion over the last few weeks about cluster investigations. Outbreaks are part of the fabric of what we do in public health, particularly at the local and state levels, but sometimes at the national level. And you've heard me talk a lot about the details of what our investigations look like. And that has led us to a lot of discussion about long-term care and skilled facilities over the past few weeks in our local community, in the state, and in the nation. On my way to work this morning, I passed a facility I pass every day, and today there was a new sign, and the sign said, "Heroes work here." And that is really true. Heroes work in all of the essential businesses that we see right now. But these communities continue to try to fight for everything they can do for the people that live in their facilities and for their employees. And heroes truly do work there. And I just wanted to take a moment to also talk about the transparency around the number of cases. The goal is that we will be able to provide, in conjunction with our state will be providing numbers, but we are working closely with our local partners around what they're seeing on the ground. And again, we work with them on a daily basis to help make sure infection is being minimized, transmission is being minimized. But the Ohio Department of Health will continue to report out cases, and we believe they'll be reporting out employees and residents of the facilities, and that will occur on Wednesdays. I wanted to just bring that up so that everyone knows where we understand that to be, and working closely with our Ohio Department of Health colleagues. And again, we're balancing transparency with privacy, and we feel it's important for everyone to have as much information as they can while we continue to protect those who are most affected by the virus. So in aggregate, meaning in whole, we can present information, the Ohio Department of Health can present information and not affect anyone's privacy. I also want to just spend a couple minutes talking about the debate that you see in various parts of the country, and including in parts of Ohio, around the measures that are in place for COVID-19. You've heard me say many times at these press conferences that we are not intending in any way to step on anyone's individual liberty, but we're trying to provide the best data-driven or evidence-driven guidance on how we can get through this infection in our community as quickly as possible, but as safely as possible. And so it's really important that we continue to provide you with guidance around the stay-at-home order, around masking, around social distancing, to make sure that we're helping every individual understand what they can themselves do and what organizations they might work for or be a part of can do. We are not through this. Life is not ready to go back to normal as we know it. And so we're working closely with our state leaders about how we can pull things back in a way that's safe. But we recognize that this has a tremendous impact on the economy. And here at the Board of Health, we always talk about how a healthy economy is essential for a healthy community. We understand that economy and jobs are critically tied to health. And so we want to try to present you with the information to balance our return to life as we previously knew it in a way and time frame that's safe. And so we'll continue to provide you with information about how what our state officials are guiding us to do impacts us here locally. Dr. Acton has said that this is more like a dimmer switch than an on and off switch, and I think that's probably a pretty good metaphor for understanding how things need to roll back into what we knew before. We certainly can't flip a switch that will certainly lead to more infections and more deaths. So we've got to carefully use evidence and data, the local and state level, to understand how to move through this return. If you have not been affected by this virus personally, or your family or friends have not, you are among a small group of people. Most of us have someone we know who has had this virus, or someone who has died from this virus that we're close to. I personally have family who've been directly affected by the infection. And so recognize if that isn't you, that there are very few other people like you, and that's a great thing for your family. But please know that others are still really dealing with the impact of this. Obviously, all of us have been impacted by the flow of our daily lives, but actually having the infection or having a loss from the infection is a whole nother level of impact. And so we recognize that, and we stand determined to try to help all of us get through this as quickly as we can. Please continue to heed the advice of our state leaders and our local officials around what we need to do to get through this, and we will do this as quickly as we can, but again, as safely as we can. Finally, I want to end by going back to a theme that I have been bringing up for probably over a month, which is around kindness. We're all very stressed. I doubt that there's a person in our community who hasn't felt some degree of stress because of COVID-19. And as a result, sometimes that erodes our ability to be kind to one another, whether it be on social media or whether it be in person or whether it be over the phone, whether it be over email. I think sometimes when we're stressed, we forget about kindness. And I could speak for myself. I know sometimes that I forget that too. So this is as much for me as it is for anyone else, but I have seen some unkind things in the past weeks and days, and I would just ask that everyone please try to remember to be kind to one another. I think this Martin Luther King Jr. quote is really one that I've been trying to live by, that says, "Life's most persistent and urgent question is, what are you doing for others?" And I think that there's a lot we can do for others, even if it's not in person right now. So I would ask you to lead and live with kindness. Try to be intentional about it, even though we're all very stressed and we have a lot on our minds. Kindness can only help us in this difficult time. So with that, we will take some questions.
I was hoping to ask about yesterday's announcement about Harbor Light. And, a few weeks ago, we also saw an announcement from you guys about Manor Care in Parma. I'm wondering how you're deciding which of these clusters you're going to talk about and release and let the public know about.
Mm-hmm.
Are there other clusters in public places the size of the Harbor Light cluster? There's 11 at least there, that we don't know about, and how are you making these decisions about what the public knows?
So the question is about cluster investigations and how do we make decisions about releasing information. So cluster investigations involve multiple jurisdictions most of the time, because people who either live or work or are involved in certain clusters, or they're related to people who are involved in those clusters, live in multiple jurisdictions. So we work closely with our other local health department colleagues who are also managing cases in the same locations. And we work closely with the leadership of each facility with whom we are engaged to determine a communications plan. Kevin, our communications officer, who you all know very well, who's in the back of the room and makes these things happen here, is engaged with each of our facilities. And as I mentioned last week, each of our facilities takes time to create messaging for their clients or their residents, depending on what kind of organization it is, their employees, and then the public. And in some cases, there may be a choice to release a media statement for various reasons. They're all different. They're all a case-by-case basis. And in some situations, they may give interviews to various media if they know them or they're asked to. But it's not, we don't do the same thing for everyone, and it's led by the leadership at each of the organizations. We're in a supportive role. So in this case, that decision was made in conjunction with the leadership.
So we'll find out about those if they decide to make it public. That's not a decision made.
Yeah, that's not our decision to make. I think we always take into account a lot of different things. We've been talking about cluster investigations every single press conference for weeks and weeks. We've been dealing with clusters, which means just 2 or more cases in one location. And it doesn't necessarily mean that they're physically in that same location. It could be 2 people who work in the same organization, 2 people who live in the same building, 2 people who were in the same group. Like, for example, before the social distancing and stay-at-home orders, there were clusters because there were large group gatherings. And so that's what a cluster means, but it depends on lots of factors as to how the media releases are done.
Tara, you mentioned guidance to cities within your jurisdiction. What are you telling cities about things like spring and summer sports and the opening of swimming pools and splash pads, things like that?
Right. So the question is, what sort of guidance is currently being made available or information being shared with our municipalities about activities in the summer like swimming pools or splash pools or other recreation activities in the summer? And so right now, we are in the stage of working with our partners here at the state level and among our folks that have been working through this response here at the local level to think about the best guidance. And so that's going to be developed very carefully here in the coming weeks to make determinations on where these activities can be resumed and done safely. And so we can't sort of take a broad brush and say that everything will come back up and begin to operate as normal, or will all these activities will happen this summer. They will be done on a case-by-case basis where the determination is being made that it can be done protectively. So I would just ask that you have some patience as we work to develop that guidance, and those are messages that we've been sharing with our municipalities, is give us time to develop guidance. Where possible, the guidance will be developed in coordination with our state partners. We have worked hard and we have great respect for our colleagues at the state level in all different departments that have been with us hand in glove in this response to develop where we can uniform guidance in response. Sometimes a municipality or a health department in a county may have some good guidance that they develop. They share that across other departments and work towards some common document that can be used statewide. So I think that's how this will happen. Since we don't have this playbook developed, it's being developed out of whole cloth. This is brand new. So that means we have to work through guidance, think about what's most protective, and be creative. And I expect there'll be a lot of that happening in the coming weeks and months to develop guidance for our municipalities as they work to make decisions about what sort of activities will take place this summer. So I would stay tuned, but that's a work in progress.
What do you expect some of that might look like at this point?
So you could see right now we have some sort of solid guidance around a range of things that we've discussed already that relate to masks and the use of masks in public, around physical distance in public, around cleaning regimens, around gatherings of crowds. So some of that may mean that some events can take place because we can assure that that physical distance is taking place, but we may have to be a lot more protective about crowds gathering to watch. And so some of those things may occur, and again, on a case-by-case basis. We're going to do what we can to try to create as much uniformity as possible. We've done that a good example is the essential service and essential business designation process. As that emerged and the governor had asked local health departments to become involved with that response, this was brand new for all of us. So there might have been some differences in approaches across the counties. And in some cases, there was guidance then that emerged at the state level in discussions around how to best address this in a uniform way. So I think similarly, we'll have to go through this process of learning together and recognizing that everybody has good intentions to try to protect our kids, protect our families as we move toward the summer. We'll be watching the guidance on what's happening relative to new cases in the community to try to understand the lay of the land and how that may relate back to risk. So this is a lot of details to consider in the process, and I think that will provide some clarity in the coming weeks, but I don't expect it to be perfect. I expect us to have some challenges as we work through this and learn and watch the dashboard of information relative to cases and data that emerges from the state and the connection to the experts that they're working with from CDC and among our local health department colleagues on what's working best for them. I think people are really great about sharing guidance and what they think is protective and also functional for our municipal governments. So I think that's the way this will work as well as it has in the past few months.
Do you expect that'll even kind of evolve as things move forward? Hey, this was working, now it's not, or there's a spike in cases, now we need to pull back on some things?
So the question is, will the guidance evolve or change over time? I think my sense is that is exactly how this will happen, because that's how guidance has evolved here in the preceding months in this response. We've had to adjust our guidance based on the situation on the ground. And so I think we will continue to do that. We're encouraged by where we sit now in Ohio and that we are seeing a plateau, but we don't want to develop a false sense of security that we can move on and sort of presume that we can go back to normal life. We are not there, and we are far from that. And that, I think, is the overarching message, which means that we need to be very careful about every decision we make as we bring normal aspects of life back, and how to do that in a protective way.
Is it reasonable?
Yeah.
Go ahead.
No, yeah.
Is it reasonable to expect there could still be things like summer camps, summer soccer teams and things where you would typically kind of have people clustered in close quarters?
I think each sport and its level of interaction will have to be assessed relative to risk. And so, I think some sports are solitary, some are done in congregate type settings, and we're going to have to look at each of those sports to make a determination on what is the most potentially effective way to reinstate those activities. So it will be on a case-by-case basis. Vic?
Yeah, as far as the protests are concerned, does that damage your messaging at all, or is that having an impact, you think, on how people are, perceiving the precautions that you're putting forward?
The question is about the protest and what sort of effect has it had relative to precautions. I think the governor has said, and we appreciate the fact that it's a free country and people have a right to share their opinions. What we want them to do, first of all, is to do that safely and do that, creating that physical distance so that folks aren't unknowingly and unintentionally spreading COVID in the community or anywhere in the state. So from our standpoint, we follow the science. We follow our leadership at the state level, which I think has been remarkable. And using that guidance, there may be folks, because of disruptions and the challenges economically, that may have concerns, and they get to express those. I think that's a part of being an American. What we believe is that the guidance and the science around public health is the best way forward to assure that we're protecting citizens, that we're preventing cases, and preventing further loss of life. And I think the playbook that Ohio has followed to date has proven, relative to others' situations, has proven to be effective. So we're going to stay the course on that front. And we hope the protesters, as they wish to continue to protest, do that safely for their families, for their friends, and for their other fellow citizens in Ohio and certainly in Cuyahoga County.
Is that undermining you at all, do you think? Are people questioning the decisions at the top levels?
Well, the question is it sort of undermining our response at all and decisions at the top levels? I guess I would say that we've had some spirited responses in our phone banks around the essential service designations. Hundreds and hundreds of calls early on to understand what that means. And that's, I think, good people wanting to know whether or not they can continue to operate. They're concerned about their livelihood. There also were a lot of concerns expressed by workers that were wondering whether their business should indeed be designated as essential service. So to me, this is part of our democracy, is this give and take and this dialogue that has to occur in order to try to get to the best place. So I think it's the fact that we're allowed to share our positions and our feelings and share that openly is an important aspect of our democracy. But ultimately, from a public health standpoint, the data has shown that the path that we have taken has been effective at saving lives and preventing cases. And so I think we feel good about that. We expect people to continue to share their concerns with us, and that's why we're here. We will respond to the best of our ability. It may not be the answer that folks want to hear, but we will do the best we can to follow the Ohio playbook and be protected. We'll take one more question.
I just wanted to ask for your thoughts on the increase in deaths that you guys reported today. That's a big number, and that seems like a bigger increase than we've seen. I just went back and looked for at least the past month's worth of data. Can you speak to why we have perhaps that jump today?
So the question is about why is there an increase in deaths now as compared with previous weeks? So there have been a number of deaths that have been reported over the past few weeks that have labs pending. So I will tell you that some of them have taken a while to come back. They were sent out to private labs who are catching up on some of the testing reporting. So some of them a few of them were deaths from earlier on, not just the last few days, that had reported. Many of those actually returned negative. You know, those deaths were reported as pending, and I keep a list and I check daily with the labs. And so some of those, you know, we ultimately knew were not COVID-related deaths. But we did have an increase in the number of deaths. We had a few days where we had a significant number of deaths reported, and I'm only reporting out the deaths here in Cuyahoga County jurisdiction. I can tell you there are other deaths that I have reported to my colleagues in neighboring county and local health departments, city health departments, because people are receiving care in our county, and so I get notified when they pass away here in Cuyahoga County, and then I notify my local health department colleagues. So I am aware that the increase in deaths was not just in our jurisdiction. I can't really say why that's the case, other than we have continued transmission happening, and we have continued deaths. And this is precisely why we cannot flip a switch on May 1st and go back to life as we knew it. There will be more deaths if we do not heed the advice of our leaders at the local, state, and state level to understand that transmission is here. There's a lot of infection here, and we know that some people are very sick with this infection and ultimately, despite the best medical care, do not survive this infection. And we just have had a little bit of a surge in that in the last week.
Well, thank you all very much for
Thank
your
you.
time. Thank you for modeling leadership with your masks. And we'll see you Friday.
Thank you.
Thank you, Heather.
There are individually wrapped brownies for you over there.
You'll have to take your mask off to eat those, though.
Thank you.